All right, so we're looking at the respiratory lab. This is going to include 36 and 37. So let's get started. Here's our model of half a head. This is figure 36.1. You can ignore picture A because I'm not going to show you dead people. So this is kind of a twofer model. It's both associated with the respiratory and the digestive system. This is also the image essentially that you're going to be doing for your bonus for this practical. So we're going to start here. The external nares, that's your nose hole. That leads to the nasal cavity. We're going to have the superior nasal concha, the middle nasal concha, and the inferior nasal concha. Then we're going to have the sinuses. We have the frontal sinus, the sphenoid sinus, and the ethmoid sinus. They don't show that one very well. Then we're going to have here the nasopharynx, the oral pharynx, and the laryngeal pharynx. Okay, so those are spaces. This is the opening to the eustachian tube or the pharyngeal tympanic tube. So eustachian again is E-U-S-T-A-C-H-I-A-N. We learned that with the ear, so this is where that duct from the middle ear is dumping into. We have our lips. We have our vestibule. Again, I'm not saying vegetable like carrots. I'm saying vestibule like a foyer or an entranceway into. It's just one of those words I have a hard time with. Teeth, oral cavity, hard palate, soft palate, uvula, tongue. The tonsils, we're going to have the pharyngeal tonsils, the palatine tonsils, and the lingual tonsils, hyoid bone, the larynx, the epiglottis, and the esophagus. So this is a picture of our larynx, and there's going to be a couple of shots for this guy. So we have the hyoid bone. We're going to have the thyroid cartilage, and this part that pokes out is the laryngeal prominence. That's your Adam's apple. Then we have the cricoid cartilage and the tracheal cartilages. On picture A, on 36.2, page 534, you do not have to know the body of the hyoid bone, just know hyoid bone. You do not have to know the cryothyroid ligament. You do not have to know the cryotracheal ligament. You do not have to know the thyrohyoid membrane. You do not have to know the arytenoid muscles. And then on the spiral side, again, just hyoid bone is good. You do not have to know the thyrohyoid membrane. You do not have to know the fatty pad. The vocal fold we're going to look at, but you don't have to know vestibular fold. You don't have to know the cryothyroid ligament or the cryotracheal ligament. So essentially, if it has the word ligament or muscle by it, you can ignore it. So here's the back and kind of top shot of the larynx. So again, we have the hyoid bone, we have the epiglottis, we have the thyroid cartilage, we have the cricoid cartilage. We are going to have the arytenoid cartilages right here. And these little pokey guys, that is the corniculate cartilage. It's kind of like the cornucopia, that little horn of plenty. So it does look like a horn shape. The arytenoid cartilages, when they move, it's going to stretch the glottis or the vocal cords, changing the pitch. So the job of the arytenoid cartilages is to change the pitch of your voice. Here's again that top shot, so we can see the hyoid bone, we can see the epiglottis, we can see the thyroid cartilage, we can see the cricoid cartilage, we have the corniculate cartilages, the arytenoid cartilages to change pitch, and there's your glottis or your vocal folds. This is a picture of the lungs. So figure 36.3 and 36.5 are going to show you all the structures of the lungs. 36.4, that's a good picture for the respiratory membrane. That's more of a lecture thing than a lab thing. You don't have to worry about that guy. The picture of the alveolar sacs and the alveolar ducts, that little inset on 36.3, that is a lobule. That is the functional unit of the lung where the alveoli are. So that's a word question. That would not be a picture question. So for this model, we kind of flip back and forth between figure 36.3 and 36.5. You can ignore picture B and you can ignore picture C. We're just going to be looking at picture A. So the structures we have, again, we have the trachea. Again, you are the dead thing. So this is the left side, this is the right side. So this is going to be the apex of the lungs. This is the base of the lungs. We have the superior lobe of the right lung, the middle lobe of the right lung, and the inferior lobe of the right lung. We have the superior lobe of the left lung and the inferior lobe of the left lung. We have the oblique fissure of the left lung and the oblique fissure of the right lung. You'll notice the oblique separates the middle and the inferior on the right side, but the oblique is going to separate the superior and inferior on the left side. So a little bit different separation there. This right here is the horizontal fissure. The horizontal fissure is only on the right side. The left side does not have one, separating the superior and the middle lobe. This is the diaphragm. We've removed the top part so we can see things a little bit better. So again, we have the trachea. We're going to have the right primary bronchus and the left primary bronchus. Right here inside is where the carina would be. The carina again helps us to cough if something touches it, like mucus or so forth. The right primary bronchus separates into 3 secondary bronchi going to each lobe, so the superior, the middle, and the inferior lobe. The left primary bronchus separates into 2 secondary bronchi, the superior and the inferior one. Then we're going to have our tertiary bronchi going to the lobules, and then the terminal bronchioles, and this is still the diaphragm. Okay. Figure 36.6 you can ignore. We don't do slides. Activity 2 you can ignore unless you can find some random sheep parts. So don't do that. That's creepy. Figure 36.7 you can ignore again because it's slide. 37, so exercise 37, chapter 37, is looking at the physiology of the respiratory system. So 37.1 shows you how the lungs, when they breathe in and breathe out, the changing position of the diaphragm and so forth. Our figure 37.2 shows you basically spirometry, which is the measure of lung capacities. You are going to be responsible for figuring this out. So if you look at the respiratory capacities, so you have vital capacity, it tells you the average vital capacity. And then the math problem, vital capacity equals tidal volume plus inspiratory reserve volume plus expiratory reserve volume. You will have to do at least one math problem figuring out those and knowing if they're normal, if they're average or not. Now the averages are up above, so the average tidal volume, inspiratory reserve volume, expiratory reserve volume. So I might ask you, here's a patient, figure out their tidal volume, and is this tidal volume above or below average? So again, you can see that on figure 37.2 how to do the math problems, what the averages of those are, as well as the definitions, because I could ask you what is a residual volume or what is the vital capacity and so forth. Now to figure that, we do use spirometers. So this picture up here is a spirometer. So 37.2 shows you a different version of a dry spirometer. So I could ask you, what is this? You would say that's a spirometer. I can ask you, what is its function? You would say to measure respiratory volumes. Okay. Figure 37.4 shows you wet spirometers. Usually those are at doctor's offices, and even though those pictures look really old, they are state-of-the-art. They just hook that to a computer. Board stuff, again, carina, as I mentioned, that's on the very last ring of the trachea. You're going to have an internal projection. So again, essentially right at this little point. And if something hits that projection like mucus or dust, it's going to cause you to cough. So you can get rid of that. The diaphragm, again, is your primary breathing muscle. It's the main guy for breathing. Surfactant is a mixture of phospholipids and lipoproteins that's going to coat the inside of the alveoli, preventing them from collapsing every time you breathe out. And the lobule, as I mentioned, you can see the picture of the lobule in figure 36.3, the inset picture. That is the functional unit of the lung, so it has a terminal bronchiole as well as the alveoli, and this is where breathing occurs and the exchange across that membrane. And that is it for the respiratory chapter. The rest of chapter 37, where it's walking you through doing the different types of spirometry, you can ignore.